Members, as long as marijuana is an illegal substance in the state of Texas, people who use marijuana for medicinal purposes are at risk of facing criminal prosecution. What my legislation does, it helps people who are genuinely sick, who use marijuana. It helps them in a way that I will explain. It's called creating an affirmative defense. This legislation would create an affirmative defense to prosecution for patients who are being treated by a licensed physician and who use marijuana to ameliorate the effects of a bona fide medical condition. I'm going to give an example in a minute. So a patient, if arrested, would have to prove in court that she or he was suffering from a bona fide medical condition and that a physician had discussed or recommended marijuana as an option to alleviate the symptoms of the condition. So we're talking about a doctor would have to discuss or recommend marijuana as an option. Can't prescribe it because it's illegal. The bill would also provide protection for physicians, for doctors licensed in Texas who discuss with a patient the medical use of marijuana as an option to ameliorate symptoms rising out of a bona fide medical condition. And this would include the same bona fide medical conditions that Marisa Marquez laid out in her bill. The bill would also provide protection for caregivers who possess marijuana only with the intent to assist a patient. So let me give an example of what we're talking about, because again, this is intended to help people who are genuinely sick and find themselves in a situation where they're using marijuana. I think the biggest difference between the two bills is that the legislation that I have, House Bill 837, doesn't legalize anything. Nothing gets legalized. So how does it work? Let's say you have a bona fide medical condition. We'll use multiple sclerosis for an example. And you're suffering from debilitating and chronic pain. And your doctor has suggested this medicine and that drug. And you've tried everything. And it doesn't ameliorate or reduce the pain. And the pain interferes with the way you live, your quality of life. It makes it difficult to work. In some cases, the pain can be overpowering. So your doctor says, okay, you have multiple sclerosis. We've tried everything. We've tried everything. And your doctor says, you may or may not know this, but 22, 23 states have either authorized the use of marijuana for medicinal purposes or outright legalized marijuana for medicinal purposes. And your doctor says, we haven't done anything like that in Texas, but I know a couple of doctors who have been either prescribing or suggesting the use of marijuana for medicinal purposes. And I've heard of some individuals, multiple sclerosis, who started smoking marijuana, and it helped. It really helped. And it enables them to live with the debilitating pain, to have a much higher quality of life, and in some instances it enables them to work, to be productive members of the community. And let's say it's a woman, she says, well, can you prescribe it? You're just going to suggest that I try it? And the doctor, no, I can't prescribe it, it's illegal. But I'm going to suggest or recommend that you try it. By the way, that's why we put the protection in the bill for a doctor who recommends or suggests that you try it. He says, I'm going to suggest that you try it. And the woman gets some marijuana and tries it. And lo and behold, she feels better than she's felt in years, in decades. And she's sitting in her living room in a wheelchair smoking marijuana, and she gets busted. Law enforcement comes in and says, you're under arrest for possession and use of an illegal substance. This is where the affirmative defense kicks in. What my legislation, which doesn't legalize anything, says is that in that situation where a doctor has suggested or recommended that a patient try marijuana for strictly medicinal purposes, and the patient is smoking medicinal marijuana in her house, on her front porch, and she gets arrested, she can go before a judge. This is the affirmative defense. She can go before a judge and say, Your Honor, look at me. I'm not a criminal. I have multiple sclerosis. I'm in a wheelchair. It hurts a lot of the time. My doctor, my physician suggested that I try it, and it really helps. It helps me live. I have a much better quality of life. I'm even working part-time because of medicinal marijuana. And the judge would have the option. Nothing is mandated. The judge could look at the situation, look at the woman in the wheelchair with multiple sclerosis, and say, you know, your doctor recommended it, suggested you try it, you did that, it's helping you, you're not hurting anyone, you are breaking the law, but because of Elliott Naishtat's bill, I have the authority to dismiss the charges, to say, go home, live your life, don't worry about being prosecuted. By the way, I do want to point out, for those of you who don't know, that that particular woman would be subject, if prosecuted and convicted, of a Class B misdemeanor, punishable by 180, up to 180 days in jail, and up to a $2,000 fine for doing what her doc suggested, for doing what she needed after trying everything else to live with the pain, to alleviate the symptoms and the pain. So that's how it works. There are two little hoops. The first is that your doctor, your physician, has to say, you have a genuine medical condition. You have a bona fide medical condition, whether it's AIDS or cancer or multiple sclerosis, whether you suffer from glaucoma, whether it's epilepsy. You have to have a genuine medical condition. So the doctor, that's the first part. It's up to the doctor to determine that. And the doctor says, you have this condition. I know of other cases in other states where marijuana has helped. Why don't you try it? Then you get arrested, and the second hurdle is the judge, who has the discretion, the option in these cases to say, you're not some stoned out hippie from Brooklyn, New York. I'm from Brooklyn, New York, so I can say that. You have multiple sclerosis, you have a bona fide medical condition, your doctor suggested it. I'm going to dismiss the charges. Now, if some stoned hippie showed up and went before the judge and said, hey man, you know, my doctor told me I could use it, and yeah, I was driving down the street with 3 pounds of marijuana in the trunk and I got busted. but I have a bona fide medical condition. I have a sore throat. The judge, no, this is important. The judge could say, "Excuse me, sir, I'm sorry. This legislation was not intended to help someone like you. You're going to be prosecuted." Some people have said, well, the doctor would have to recommend or suggest the use of it. No, it's up to the doctor. The doctor doesn't have to do anything. So nothing is legalized, nothing is mandated. The doctor could choose to recommend that a patient try medicinal marijuana. And then we flip to the affirmative defense. Nothing is mandated. The judge could look at the situation, make a determination, could even ask the doctor a couple of questions if necessary, and the judge would be empowered, would be authorized to say, go home, be careful, live your life. Charges dismissed. That's the bill. Yeah.
Representative Collier.
Yes, thank you, Madam Chair. Chairman Naishtat, thank you for bringing this bill. I just want to make sure, because right now a physician is not supposed to make that recommendation, because I was just concerned that it has to be in writing, that the physician, but this is going forward. Once the bill passes, if a physician writes it in, puts it in writing, then they can do so with the assurance that nobody's going to come after them criminally or legally.
First of all, the bill doesn't say anything about putting anything in writing.
Well, it says that they have to prove that the physician had discussed or recommended marijuana.
Well, she could establish that in many different ways. It could take a note from the doctor. The doctor could come and testify. I don't think that's going to be a big issue.
Okay, I just want to make sure, because if they have to not only show that they're suffering from medical condition, but they have to prove that the physician recommended it. You know,
Yes.
so it just has to be in writing somehow, unless the doctor comes in and testifies live.
That's right. The doctor could come. It's up to the judge. If the judge sees, in this case, this woman who's clearly has multiple sclerosis, is in a wheelchair, and says that her doctor recommended it or suggested it, the judge can say, well, I don't believe you. I want that doctor to write something or come down, in which case the doctor would have to come down. But I think in most cases where it's clearly a bona fide medical condition, the judge is going to say, okay, and what happened when you tried it? And in this case, the woman would say, it helps me, it helps me.
Okay, so then also you talked about glaucoma. Optometrists treat glaucoma, but they're not physicians. Would they be able to provide the evidence that's needed to support the suggestion or recommendation for this?
We're not spelling out details like that. I would say the answer is yes.
Well, it says physician.
Are they physicians?
No, optometrists are not.
Exactly.
But they
So-
do treat glaucoma, which is one of your conditions.
Yes, they do.
So I would like to add optometrist, if you would consider that.
If I would consider it?
Yeah, I mean, if they
course.
treat glaucoma, then we could
Of
probably.
course I would
Okay.
consider it.
Thank you.
Any other questions, members?
Right quickly, you know, because of Representative Naishtat, now I'm on all the marijuana bills. Because I joint authored his affirmative defense. It was really creative, I thought. But I wanted to ask Representative Marquez, now, I know why you're bringing this bill, but if you could just, I mean, you know, explain, just say, tell us why this became important for you this session, because I think that there's a lot of movement, and I say that what we are saying with Elliott's bill, with Representative Sheriff Naishtat's bill, was that, you know, he's the one who moved me over the line. So just tell us a little bit about your constituents and others that you know, compelled you to do this, because I think it's important.
Well, I mean, quite honestly, this session, this is my second session on appropriations, and I'm on Article 3, and which is the education subcommittee, and I saw the amount of money that we have put in the appropriations process into research. particularly MD Anderson, CPRIT, $3 billion.
Yep.
And we tout ourselves in Texas as one of the states leading in research, medical research. And we put so much money into these institutions, but yet we're not looking at the medical uses and treatments of marijuana. And that's important. I mean, we put ridiculously good amounts of money into these research institutions, into healthcare, into cancer research, and we are not looking at something that is that's been around for many generations, years. That's why it became important to me. We're always looking for the newest drug out there. Pharmaceutical companies are always coming up with something brand new to alleviate pain. And we have Texans that are suffering. We have a veteran on this committee right here. 2 veterans, I'm sorry. I got to give deference to my El Paso colleague here. But, we have 2 veterans, and we have people that are coming back from the war, PTSD, that they have tried everything. They've tried Darvocet, Vicodin. They've tried so many painkillers that have put their liver through so much that they are not leading a quality life. And this is something that we need to seriously look at, and that has been there for generations, since the beginning of time. You know what I mean? And we're not looking at and how it can treat these debilitating diseases. Do Texans deserve this? Yes. We say that every day. When we come here, we fight for those appropriations for that research. We say it every single time. We say everybody has said it with their votes over and over and over, that we need to put more money into this research, but we can't look at marijuana as a way to treat these diseases. And this bill is very specific about which diseases. And like you said, you can't have a sore throat and say, I need marijuana. You know what I mean? You can't, sprain your ankle and say, these are people that are suffering. These are Texans that are suffering. These are veterans that are suffering. These are children that are suffering. And we can't neglect that. We can't continue to say, well, you know what I mean? Let's look for the newest, most expensive drug and put them on it and have them, and to the detriment of their future health. So, I mean, that's why I brought it. I was astounded by the money that we put into these research initiatives.
What's interesting, I would have known this had I not had type 2 diabetes, but peripheral neuropathy is painful. So with the number of people with diabetes who probably have neuropathy and can't sleep at night because their knees and their joints and their legs and everything just hurts. I never would have thought about pain, so I thank you for bringing this bill.
And I thank the chairman for allowing this hearing. I think that you're seeing the trend across the nation. I think Texas we pride ourselves on so much research. I think it's time that we have this discussion and really bring the suffering of these Texans to the forefront.
Thank you. Welcome, all you Texans. We're just